We are not.
Mr. President, I have 6 requests for committees to meet during today's session of the Senate. They have the approval of both the majority and minority leaders.
Duly noted.
Thank you, Mr. President. I rise today to talk about some friends of mine. Roxy Rains-Cornegay. Roxy Rains-Cornegay, my cross-the-street neighbor for nearly 30 years, died of COVID last Thursday night at 6 o'clock. Roxy's been kind of the matriarch and the pillar of our little 4-block-long neighborhood. We have the annual, party in the median in October, and Roxy kind of presides. She has been sort of the caretaker, always taking care of a family member or a friend. One of the first persons who reached out to me when Roxy passed was a city councilman in Pasadena, California, who had heard instantaneously. He used to be the deputy police chief in Richmond and said, when I moved to Richmond, I didn't know anybody. Roxy was the one that kind of adopted me and showed me the ropes in Richmond. Roxy was a pioneer in Virginia government, making opportunities for African Americans to get hired into key positions, a civil rights leader in the state. My wife and I and our whole neighborhood is just absolutely devastated by the loss. My wife and I were talking about, how old do you think Roxy is? We always viewed her as sort of our age because she's so vigorous and fun and lively. She's 20 years older than my wife and me. 3 days before Roxy Rains-Cornegay died, another neighbor of mine, Sheila Mant, who was 55 years old, died of COVID. Sheila was a dynamic activist in the Richmond community with a real heart for nonprofit organizations that focus on the needs of survivors of domestic violence. And she had done pioneering work in that area and worked with other organizations too, like the Salvation Army and others. She married for a long time to another friend, Chris Hilbert, who had been a member of the Richmond City Council. 3 days before Sheila Mant died of COVID, Patsy Arsenault died of COVID in Richmond. Patsy is the mother of my parish priest, Father Jim Arsenault. Tiny little parish in Richmond, and Patsy has been, very much a part of our parish community. So in 8 days, 3 people that I know died of COVID. And this morning, I heard early in the morning that another dear friend, and I'm not going to mention his name, but another dear friend of mine is in the hospital with COVID on a ventilator, somebody that I know very, very well. I officiated at his wedding about 15 years ago when I was governor. I'm a healthy and wealthy and privileged person. So if this is happening to me and my network of friends and family, I know it's happening to others. I think this now makes 9 people that I know who have died of COVID. I was on the phone yesterday with Taiwan's representative to the United States. The representative is essentially their equivalent of the ambassador, and she told me that Taiwan has had 9 COVID deaths. Dozens of miles from China. They have had 9 COVID deaths. I hadn't gone back to check that, but my wife and I have 9 friends and family, including the mother-in-law of my brother, who have died of COVID. We had 3,406 deaths yesterday in the United States of COVID. Basically, beginning on about the 20th of December, the daily death toll in the United States to COVID has virtually every day eclipsed the number of Americans who were killed on 9/11. We've now eclipsed 447,000 deaths to COVID. And so my own feelings of sadness about my friends are just shared in common with everybody. Everybody has been touched by this, knowing somebody who's ill, knowing somebody who's died, maybe having COVID themselves, maybe having lost a job, maybe having lost a business, maybe having not been able to go see a parent or grandparent in a nursing home, or not been able to travel to see a brand new grandchild. This touches everyone. It doesn't touch everyone equally. Those getting COVID and those dying of COVID are predominantly minorities. Those losing jobs to COVID are predominantly minorities, young people, women, people working at the lowest end of the salary scale. So why do I take the floor to talk about Roxy and Sheila and Patsy and my other friend who I just learned this morning is on a ventilator in a hospital? I take the floor because this to me is just evidence underlined with an exclamation point that we have to act promptly to provide a suffering nation more COVID relief. And we shouldn't be stingy about it. We've got to be bold about it, because the amount of suffering that people in this country are undergoing is still so staggering, nearly unprecedented. The scale of the problem is so big. The health scale of the problem, that many deaths and millions having had COVID. The economic scale of the problem, we're still down 10 million jobs from where we were 1 year ago. And that's with some significant recovery occasioned by the investments that Congress has been willing to make in the first 5 bills that we passed. Even those having had significant effect in our states and communities, we're still down 10 million jobs. And then we're also down in the intangibles. It's not just the numbers of cases and the numbers of deaths and the numbers of hospitalizations and the numbers of businesses that are closed and the numbers of people that have lost jobs. It's the scale of sadness and unhappiness and the consequences that will go on for some significant period of time that we're still living under. Two examples, and I could give 50, just as any senator who stood on the floor could give 50 examples, because we're all hearing from this. Mental health needs of frontline healthcare workers. I had a Zoom session with doctors and nurses around the state not long ago, and the stories just break your heart. One nurse, I'm used to death. I mean, this is what I do. I've been a nurse for 20 years in this hospital, but I'm sort of used to maybe 1 death per week on the shifts that I work. I'm not used to 3 deaths on a shift day after day after day. Another nurse jumped in from a different part of the state and said, "That's right, let me tell you what's the hardest thing for me." And the nurse said this, "Maybe the most important thing I do as a healthcare provider is when somebody is dying in the hospital, I escort their family into their room so that they can have some last moments together as a family, sitting around the bedside and holding the hand or exchanging memories with their parent or their spouse or a child or a sibling." Can't do that now. People dying for COVID because of exposure risk. I can't make this place sort of a sacred place for family to say a last goodbye. So it's up to me to do it. And I have to go in there, and I'm wearing a mask. I can't even smile at the person. I'm probably not even supposed to hold their hand, but I do anyway. And then what I do is I bring in my iPad, and I hold it a few inches from the dying person's face so that they can have a end-of-life discussion with family members who can't be there at the bedside and be there with them. And the nurse who told me the story said, "This is really tough." It's tough to do it day after day after day and be the last person on earth that so many people are seeing and try to manage that really intimate and important and sacred moment between a dying person and their family when they're gasping their last breath. A third nurse then cut in and said, "All those things are true. Let me tell you, for me, what's the hardest? What's the hardest for my mental well-being in terms of doing this every day? I do what the other two have just described. And then I get done with a shift, and I'm just beat. And I don't want to take that home to my family. I don't want to take that frustration and depression home to my family, so I drive around for a while until I can kind of clear my head. And invariably, when I'm driving around, I'll go by some place like a restaurant or bar, and I'll see a whole lot of people there with each other without masks on. People who think the mask thing is fake or it's a political thing, and they're making a statement by not wearing a mask and not following basic health guidelines. And after the day that I've gone through and the challenge to my own mental health and seeing this, I see that happening. I'm like, you're going to be in the hospital next week. Do you know what you're doing to yourself? Do you know what you're doing to your family? Do you know what you're doing to me? I'm going to be having to hold that iPad in front of your face, or maybe somebody else you're with as they talk to family. The healthcare needs of our frontline healthcare workers who have been besieged by this pandemic, they're not going to go away the day we say we're past COVID. The challenges that people have endured to be the heroes that we claim them to be are not just going to immediately go away. Part of this COVID relief bill needs to be about keeping our own healers healthy. Second example I'll give quickly is housing. Thank goodness in the COVID bills thus far, we've been able to find some bipartisan agreement to extend evictions, put a moratorium on evictions, put a moratorium on foreclosures for properties that have some federal connection, financed through, Fannie or Freddie or FHA. If they've got a federal nexus, we provide an eviction moratorium. Okay, that's really important. But what about when we get to the end of the moratorium? Families have big obligations that are backed up. Maybe they've lost job or lost income. Can they come current then on their obligations when we're done with the moratoria? Or will they then face eviction after they've gone through the unimaginable of COVID and now we're past it? Will they then face eviction because their resources will not be sufficient to catch them up with their back due obligations? And it's not just the residents, Mr. President. What about the landlords? So many landlords of rental properties are small business owners, and they provide housing to families, and they have to pay off mortgages too. And we also want them to keep the properties up, to keep them safe, to keep them habitable, to keep them as dignified places where people can live. But if rent isn't coming into them, how can they pay off their own obligations? How can they keep up the quality of housing where people live? I could have talked about the needs of the unemployed or the needs of people who use childcare. At one point in the summer, 40% of childcare institutions in this country were closed down. That makes it so hard to open our businesses. I could have talked about the tremendous needs of small businesses. Thank goodness it's been a bipartisan priority in all the bills we did in 2019 to prioritize small business assistance. These needs are intense. There are some positive signs. Hospitalizations and cases are starting to go down, even though the death toll remains high. But this challenge, we are not done with it, and we're not near done with it. And that's why we've got to go big, in my view. And that's why we have to do it with a sense of urgency. Mr. President, I want to conclude and just say that the budget reconciliation tool that was part of the Budget Control Act of 1974 is about doing big things with a sense of urgency. I'm getting asked sometimes by press as I wander around, well, should you use reconciliation or should you try to be bipartisan? I said, hold on a second. Reconciliation isn't partisan. Reconciliation was a part of a Budget Control Act put in place 35 years ago, and budget reconciliation has been used for some of the most bipartisan positive achievements of Congress in recent decades. CHIP, the Children's Health Insurance Program, that was done with reconciliation. Earned income tax credit, that was done with reconciliation. Reconciliation is a tool. You can use it in a bipartisan way or in a partisan way. It's also been used in a partisan way. The effort to undo the Affordable Care Act was done by reconciliation with no support on the Democratic side of the aisle. The tax cut bill in 2017 was done via reconciliation with no support on the Democratic side of the aisle. But choosing the path of reconciliation is not the opposite of bipartisanship. I so applaud President Biden, Vice President Harris for their earnest dialogue with our Republican colleagues. And I applaud my Republican colleagues for going to the White House and talking about what should be in this bill. Because as they share their priorities, they're going to shape this bill. And I can, without having seen the bill, I know no one has, I can make a guarantee about this bill, and I am 100% sure I'm right about this. When this bill hits the table and the negotiation is done, and before we have a final passage vote on it, and we analyze what's in the bill, we are going to see so many priorities in this bill that are not just Democratic priorities, that are Republican priorities too. Things that were drawn from bills that Republicans introduced or that Republicans co-sponsored with Democrats. Things that were raised by Republican senators in their dialogue with President Biden and with us. We're going to see a bill that meets the need of Americans who are suffering to do something big and to do something urgent, and includes priorities that were Republican senators' priorities, that are good for Republican voters, that are good for all Americans. And so, Mr. President, this is the second time I've done a floor speech where I've gone over the names of people that I know who've died of COVID. I don't want to do a third speech. I don't want to do a third speech. I think it's important to say people's names so we remember them and so we honor them, but the best way we can honor them is not through a floor speech. The best way we can honor them is acting in a compassionate and prompt and significant way to ease the suffering of Americans during this most unprecedented time. With that, Mr. President, I yield the floor, and I note the absence of a quorum.
Clerk will call the roll.
Ms. Baldwin.